Good afternoon, and welcome to the Board of Health meeting for January 8, 2019. And I'm chair of the board, well, I will be shortly, chair of the Board of Health, John Hutchings. And to my left is Commissioner Gary Edwards. To my right is Commissioner Ty Menser. To his right is the clerk of the board, Lydia Hodgkinson. And to her right is the Director of Public Health and Social Services, Shelley Slaughter. To her right is Dr. Rachel Wood, our health officer. And to her right is Ramiro Chavez, our county manager. And so with that, I'll ask for approval of the agenda.
Motion to approve the agenda for Tuesday, January 8th, 2019.
Second.
It's been moved and seconded. All in favor say aye.
Aye.
Aye, and we have an agenda. And approval for the meeting minutes. I need a motion.
No, I have a question as far as process. The commissioner was not here for that, so do I?
Oh, that's true, that's true. You can make the motion, yeah.
Do I need to make that motion?
You can introduce the motion, abstain from the vote.
Got it. Okay. Thank you for that.
Just trying to clarify.
So I will introduce a motion to approve meeting minutes from November 27th, 2018 public hearing, December 11th, 2018 regular hearing, and December 14th, 2018 special meeting.
Second.
Been moved and seconded, and are you on mute?
Sorry about that.
It's been moved and seconded. All in favor say aye.
Aye.
Aye. And you're abstaining?
Yes.
Okay. That motion carries. And let's go to, let's first do the, before we get to presentations, the election. Go ahead.
Good afternoon, Commissioners. Welcome, Commissioner Menser, to your first Board of Health meeting. We're very happy to have you here.
Thank you.
Each year, the Board of County Commissioners and Board of Health convene to decide who will assume the role of Chair and Vice Chair of the Board of Health. You met last Thursday to discuss that, and today the recommendation for you to consider approving is Commissioner John Hutchings as Chair of the Board of Health and Commissioner Ty Menser as Vice Chair of the Board of Health.
Okay. So is there a motion? Is there any discussion? Motion?
I move to accept and adopt those nominations as set forth by Ms. Slaughter as to the Chair and Vice Chair of the 2019 Board of Health.
Second.
Been moved and seconded. All in favor say aye.
Aye.
Aye. That motion carries. Thank you. And the next, now we have the proclamation. You want to frame that, the proclamation?
Sure, I'm happy to do so. We are here to ask you to proclaim January as National Blood Donor Month. Each year, you consider this proclamation because January is a month in which blood supplies greatly diminish and more donations are needed. We have representatives from Northwest Blood Works here to tell you a little bit more about their program, and we would like to encourage our citizens to save lives by donating blood. So I believe they're going to come up to accept the proclamation.
Okay, would you please come on up and tell us who you are, by name anyway, know where you work.
I'm Randy Green with Bloodworks Northwest. I'm the volunteer manager out of Olympia branch.
Hey, I'm James Moore. I'm the Center and Mobile Supervisor from our Olympia Donor Center.
And I'm Lynette Manning. I'm the donor recruitment representative from Bloodworks Northwest in Olympia.
Beautiful, and you were just here on Friday.
Yes,
At
we
least
were.
Bloodworks
Thank
was.
you for having us.
Yes, you're very welcome. So thank you for coming, and we have a proclamation to read.
So, the proclamation is Thurston County Proclamation National Blood Donor Month. Whereas in 1937, the first blood bank in the United States opened, and in 1969, President Richard Nixon proclaimed the first National Blood Donor Month, praising the generosity of the American people, declaring, quote, "No manifestation of this generosity of spirit is more expressive, and no gift more priceless in time of personal crisis than the donation of one's blood. The voluntary blood donor truly gives life itself." End of quote. And whereas since 1970, National Blood Donor Month has been observed in the month of January with the goal of increasing blood and platelet donations during winter, which is one of the most difficult times of year to collect enough blood products to meet patient needs due to inclement weather, often resulting in canceled blood drives, and seasonal illnesses like the flu, may cause some donors to become temporarily unable to donate. And whereas 1 pint of blood can save 3 lives, and in the United States approximately 36,000 units of red blood cells, 10,000 units of plasma, and 7,000 units of platelets are needed each day. And whereas every 2 seconds someone in the U.S. needs blood, and a single car accident victim can require as many as 100 pints of blood. And whereas the blood used in an emergency must be on the shelves prior to an event occurring, thus blood donations are needed more than ever after large-scale emergencies, especially since it cannot be artificially made and can only come from generous donors. And whereas millions of people donate blood each year, but only an estimated 38% of the U.S. population is eligible to donate blood at any given time, and of those who are eligible, only 1 in 10 donate. Now, therefore, be it resolved, the Board of Health hereby proclaims January as National Blood Donor Month to increase public understanding of the importance of blood donation and urge citizens of our community to donate towards this life-saving cause. Adopted this 8th day of January, 2019, Board of Health.
Thank you.
Thank you.
Thank you. And is there any comments?
No, I'm a blood donor, and I hope I never need your services, but I'm glad you are there to help others that do.
Any comments?
BloodWorks, how many folks work with your organization?
Out of Olympia?
Mm-hmm.
Oh, yeah, up to the microphone.
He's the supervisor.
And get that
so I'll
mic
let
right in
him
front of
answer
you.
that.
We have 2 mobile units and a center staff, and our center's open 6 days a week, and we have mobile units that go out into the community almost every day, 4 or 5 days out of the week. And so you've probably seen our Bloodmobile bus around town, and our other mobile unit sets up inside locations like this room, and we were here not too long ago. But a total of 18 staff and then volunteers each day. Yeah, and that's just in Olympia. We're part of a bigger blood center family in Western Washington. Yeah.
Perfect, thank you.
Well, it is the gift of life, and not this last Friday, but when you were here last, a few months ago, I donated. I tell you what, your staff are awesome, and there was nothing creepier about donating blood at all. It was fun and engaging. Thank you very much.
I'll let them know you said so.
Yeah, would you please? Yes. Shelley?
We have people that watch this on television, and if someone is interested in donating blood, how can they do so? Can you describe a little bit about what that process is and where they might go, or where you're going to be around January if someone's interested in donating?
I can speak on the process. You want to talk about where we'll be?
Yeah.
Okay. So the blood donation process, there's an age requirement, so you have to be 16 years of age with parental consent, 18 otherwise, and you can make an appointment at one of our locations, come down to our center. We take walk-ins also, but the process takes about an hour and a half in and out the door to donate blood, because we do a medical history questionnaire, check some vital signs, then the actual blood draw itself where we take a pint of blood. We need dedicated donors who come in every 8 weeks, and that's just for whole blood. But there's 3 separate components of blood, and so we collect those different components using different processes at our center. And so that's it. You come in, register, fill out a little questionnaire. We check your vital signs, and then the donation itself, and then juice and cookies, which is the good part there.
Anything else?
No.
Gary?
And as James mentioned, we have blood mobiles that go out pretty much daily, and so we are located all around town throughout the month. If you're curious about where we're going to be next, you can go to our website at bloodworksnorthwest.org and click on donate. You just have to put in your address or a zip code of where you're going to be, and it'll let you know the next blood drive in that area. So you can schedule right online. And we also have a new BloodWorks app that you can download both on iPhone and Androids, where you can just have touch a button right there on your phone, get signed up, see where we're at on our blood mobiles. Also, our location for our center is downtown Olympia, 1220 East Side Street, Southeast.
Thank you so much.
Gary, go ahead.
And I guess coming from an individual's point of view that is scared to death of needles. When I gave blood last, which I know you were out here one time, I have to say, if you don't look, it doesn't hurt. So, and then maybe for those people that are less technical, could you give a phone number that the public might reach your office or something like that besides the computer?
The best
Up with
number.
the mic, get right up under it, thank you.
Yeah, the best number to reach us at is 1-800-DONATE-1, and that goes to our call center, and they have knowledge of all of our blood drive locations, and they can schedule you here in Olympia at our center or on a blood drive.
Is that donate and the number 1 or donate?
Donate and the number
O-N-E?
1.
The number 1,
Yeah.
okay.
Yeah.
Thank you. What is the most rare blood type?
Rarest blood type would be AB negative, is that correct? Which is 0.5% of the population.
No, I thought I had that, but I don't.
Yeah.
All right, thank you, very kind. No, we have the proclamation to deliver and a photo opportunity.
Here's the original.
Yep. In a blue folder.
If there's anyone in the audience that donated blood, please join us in the photo.
There's art. Yeah. Art, you just got your 100.
I know.
That is amazing. That takes 16 years of donating whole blood.
Who might present this to?
Yes, I got the pins.
I didn't talk, so I'll hold it. I held it last year too.
Okay, where am I supposed to be?
Right next to me.
Oh, okay, there you go. Thank you.
Art, anybody that's give 100 that gets to stand wherever you want.
Okay.
All right, everybody smile. Or do you want to come? We're going to put one up on Art. Oh, you need a stick.
Do you have everybody in? Do we need to
Did you
squeeze
get
in? You got
everyone?
it? You got everyone?
You got everyone? Okay. And do you consent to being on the board?
Okay, I'll sign it.
You're more than welcome,
Do you
thanks.
consent to be on the board? Thank you very much for inviting us. Oh, thank you, thank you. Sorry, my hands are full.
Now I'm thirsting for V8 juice, suddenly. All right. Good on you. Now, this at the point of the agenda item number 3 is the opportunity for the public to address the Board of Health. And I have no idea if anybody signed in. I'm not going to presume. No one did sign in. Okay. So they had the opportunity. Thank you for that. And we're moving on to item number 4, which is the consent calendar. We have item number A, which is the work session notes from October, November, December last year. Oh, we already did that, didn't we?
No, we did the minutes.
Meeting minutes.
Meeting
Okay.
minutes to the
These are the
agenda.
notes.
Okay, so motion to approve acceptance or accept work session notes from October 30th, November 6th, December 4th, and December 11th, 2018.
Second?
Been moved and seconded to accept the work session notes. All in favor say aye.
Aye.
Aye. And that motion carries because you're abstaining.
I'll abstain.
Got it. So thank you for that. That's done. Item number 5, department items. Now we're going to the Public Health and Social Services legislative priorities, and we have the legendary Art Starry in the audience.
Good afternoon. I'm Art Starry. I'm the Environmental Health Division Director. And like Commissioner Edwards, I don't look when they put the needle in when they do the blood draw stuff. I can get through it, but I don't like to look. And so what I'm here today is to talk a little bit about the Public Health and Social Services legislative priorities and kind of the process that the different organizations that we belong to go through to try to evaluate legislative proposals and things, and kind of how county staff participate in that. I guess I have the distinction of being a member of the Washington State Association of Local Public Health Officials Legislative Committee. I've been on that for a number of years. I'm actually the co-chair, which I'm not sure what that means other than they're desperate. But and I've also been on the Environmental Health Directors Legislative Committee for a long time. So I've been involved with reviewing a lot of bills and things, and on occasion get asked to comment or even go to the legislature to talk. And I think that's both a combination. I'd like to think that it's because they recognize what a great health department we are, so they want the best people possible testifying, but I also know it has something to do with our proximity to the legislature. So what happens is, attached to your packet are some legislative priorities that have been identified by WSALFO, the Washington State Association of Counties, the Association of ACHS, who's an acronym I can't remember, Association of Community Health Services, and then the Housing Alliance. And what happens each year, as you know, with the legislature about to begin, and that starts on the 14th, the different organizations identify their legislative priorities for things that they anticipate are coming forward. And again, you'll see that there's a bunch of things, and many of which are in common. If you look at what's I think a priority for our health department and for the county and for WSALFO, it's public health funding. There's something called foundational public health services. The governor has been asked to put money, or actually the legislature has been asked to provide adequate funding for public health foundational services. And that really, if you were to look at the list, if we had a way of making it bigger and bolder and everything else, that would be the top item. And so while there's 6 or 7 items listed for WSALFO, really the big one is the foundational public health services funding. And as you know, we've talked to the previous board about this before, but really the issue there is that there's a lot of things that health departments and the county health folks are asked to do, and we don't really have adequate funding. So for instance, when we had I think Shelley's going to talk a little bit about an incident at the hospital with Ryzen later on today. We had to marshal up forces to try to work on that. We really don't have funding for that. We had couple years ago, we worked on Summit Lake. Didn't really have funding for that. There's things like that happen all the time. Food recalls, trying to provide advice to advisory committees. There's dealing with infectious disease, trying to deal with communicable disease outbreaks. The funding isn't really sufficient. So and it's not just a Thurston County problem, it's a statewide issue. So that's why there's a request to have additional funding from the legislature. So that's really like I said, the big one. The governor was nice enough to put some funds in his budget for foundational public health services. There's $20 million that he's proposing. However, the need has been identified as much greater than that. The handout that I've given you says that it's $295 million, so it's a kind of a drop in the bucket. So progress, but not really what people were hoping for. You'll also see that there are other issues that are identified, and not surprisingly, a lot of them have to do with funding or unfunded mandates, things like making sure there's adequate funding for local solid waste programs, both at the health department and at the county, funding for our Group B water systems, trying to make sure that there's adequate resources for some of our vital records control systems, and also trying to make sure that as the legislature works on stuff, they aren't doing things that erode the authority of you as the Board of Health or our health officer or health rules. Periodically, someone will develop proposed legislation that says, we really think that the Board of Health doesn't need to have authority over this anymore, and so that's of concern when those things come forward. So those are a few of the things that are on the list. When you look at the Washington State Association of Counties, you'll see that they have 3 big priorities, and the one that I'll focus on again is foundational public health services and funding. They've got 3 big requests, and that's one of their big 3, along with indigent defense and fish passages, or they like to refer to it as culvert stuff. So as you know, as the county commission, when you're acting in that role, there's a lot of things that come up about that, and so that's a big priority for WASAC. Other associations who've weighed in on this or have their their priorities, again, are ACHS, which is the Association of County Human Services, and their list is attached. A lot of their focuses have to deal with housing and with dealing with folks who have disabilities. And you can look through the list there, and there's some things in common with them and with the Housing Alliance, for instance, trying to make sure that there's an adequate investment in the Housing Trust Fund. And that, I'm not an expert on that. There's actually folks out here who are, that could talk about what the purpose of that is, but it's to make sure that there's sufficient funding to help folks with low to moderate incomes be able to afford housing. And as you know, there's a bit of a housing crisis. We have a homeless population and the housing crisis in Thurston County, and so that's attempting to provide more funds there. There's also a request to help that there's more local communities retain a portion of the state's sales tax to invest directly in affordable housing. So those, again, are important things I think that you've heard about actually for the past few years, and it's good that there's a kind of a shared agenda, that there's multiple groups who are working towards that same task. And so you'll see that as things go forward, you're likely to hear us come and talk to you about maybe legislation that's being proposed that would affect that, and whether or not you support that and whether we can support that on your behalf. I won't go into all the details of these different lists, but what I will do is talk a little bit about the process that we use and typically the sort of things that we're asked to do and as staff. So we typically get involved in one of three ways. One is through these professional associations like WSALFO or these environmental health directors or WASAC. We'll be asked, to review a bill or to provide comments to say, what do you think of this? Would it affect your department? Would it affect your county? What do you think sort of position we should take? So we then provide comments to them, and then they work. They have professional staff and sometimes lobbyists who work on their behalf to try to bring issues forward. So that's one thing that happens, and I end up doing that quite a bit along with other members of our staff. A lot of times, because we're, like I mentioned before, we're here in Olympia and we have good programs and we have expertise, we'll be asked to testify to the legislature or to make reviews on behalf of the county. And so we'll do that, but only if we get permission. And we can't advocate on behalf of the county unless it's something that you've adopted or you give a specific authority to do that. And so the process typically goes, someone will contact us, then we'll, at least in the past, what we've done is we would send a note to the county manager and say, here's something that's going on, here's what we've been asked to do or what we're asked to comment on, and then he would screen that. And sometimes that might mean that I come back on Tuesday morning and talk to you about it, or sometimes if it's something that's already on your adopted agenda or maybe it's on the WASAC agenda, you'll say, you can go ahead and do this, but under these these terms or conditions. And the other thing that often happens is, again, because we're in town, is the legislative staff or a committee staff will contact us for information or factual information about a bill. How do things happen in Thurston County and how might this affect it? You might be surprised to find out that I get a lot of phone calls about septic system bills, because I unfortunately know a lot about that. And so they'll ask, well, how might this pan out as far as the cost? How would it affect Thurston County? And when we're receiving those sorts of requests for just factual information, we'll reply. I ask, for instance, my staff if they're contacted to contact me so I could let Shelley and Ramiro know if we're providing information. But that's the sort of stuff where if we have time, we'll try to respond to those and provide the best information that we can. But as far as actually, again, going and speaking on behalf of the county or something, we make sure that we're following process and following state law, and we aren't stepping out on that. So that, in a nutshell, is the legislative stuff and our priorities. As you can see, I fully anticipate that you'll be asked, probably as the Board of Health, to perhaps sign a letter or to take pass some sort of resolution in support of the foundational public health services. That may be something that comes later, because again, that is a big issue for us, and I think in the past it's something the board has supported. And as other issues come forward, I'll bring them to Ramiro and to Robin, and I know that the county has also retained a legislative consultant to help on things, and so we can try to work together to make sure that everything's coordinated and that no one's stepping on each other's toes. I should also indicate that one of the important things we do at WSALFO, because that's an affiliate of the Washington State Association of Counties, is that we work very, very hard to make sure we're on the same page with that, because it would be bad for the public health folks to be out of sync with their commissioners. So we work really hard on that to make sure we're on the same page.
Thank you. Any questions or comments?
Art, I had a question. I don't see any in the WSALFO priorities. There's nothing about housing. Is that because it's a county, that's a statewide, and you're trying to balance the different counties' priorities?
It's a priority, but it's not listed there. What we try to do is the things I guess it is a priority, but it isn't listed. Again, because the foundational funding stuff is big, and it's probably more of in hindsight, it should be listed because it is a big deal. I expect there'll be legislation on that, and that WSALFO will be asked to make comments on that in support of things, and so I fully anticipate that.
Okay, Commissioner Edwards?
I guess when it comes to housing, I've heard from maybe those affected more than others, that the cost of housing could be as much as 25% to do with permits and fees and inspections. Are you aware of any number like that? Have you ever
I saw the
discussed that?
presentation from the master builders that was presented to you, and talking about some of the different costs associated with housing and how to bring that down. I'm afraid I didn't get a chance to evaluate that or understand it in more detail, but I have seen presentations to that effect.
As we move into reviewing that a little more closely, is there any chance you could do something like maybe give us some input as to what we could do to reduce the cost of permits and inspections and those type of things, but also what would the impact of that reduction be? So I know we do get asked those kind of questions. So as a housing issue, I do think it's going to be probably coming up at some point.
So I can try to work on that. I know that you've made efficiencies and things a priority, and that's something that we're looking at a lot in environmental health, because besides just the permit cost, the other thing is that if there's additional delays in projects, and now you're having to, if you're a homeowner, a home builder or a developer, now you're having to finance something for extra months, that's a cost. So there's all sorts of things that build into it. So we are looking and trying to do things to make it work as efficiently as possible to give the people the information they need. So I'm talking around things a little bit, but that's one of our priorities, and I'll try to look into these other things as well.
Yeah, and maybe get back to us at a later date. Thank you, sir.
Okay, thank you.
You made a good point, Art, in that we being the capital county with the capital city and the legislature just down the hill from us, that it's very convenient for us to go and attend and lobby for such important legislation.
I try to educate and inform. I can't lobby.
Right, I understand that, and I'm glad you explained why you can't, why it will go through the county manager and us. But it's a tremendous opportunity for us as well. And at the legislative dinner last night, the senators and representatives there were encouraging. They said, we always have the lobbyists come in, and they have great information, but they love to have local electeds come in and local officials that deal with the issue, and then citizens coming in with a story about how the issue impacts them. That is far more powerful to the legislators than just a lobbyist. So it's a great responsibility and an opportunity. So too bad you're limited, but I understand the rules.
Yeah, well, I mean, I've been asked to talk about, again, different things, and within the realm of what I can, I provide local information, and that I think you're correct, that people kind of perk up when they find out about how did this affect Thurston County, or what made things work or what didn't, as opposed to, like you're saying, someone who's maybe a bit further removed speaking on that. So I agree with at least my limited experience concurs with that.
So thank you very much. Romero.
Yeah, I'd just like to go back to the conversation on the housing and the costs. And I've seen that presentation, the 25%. And we'll come back, we'll give you additional information to the board. But when we talk about the 25% of permitting fees, it's not necessarily how much it costs to process a permitting fee, let's say on the permitting department. Most of that cost is associated with the impact fees. Schools, fire districts, traffic impact fees, all that accumulates on the cost. So I'd just like to make a clarification for the public. Then we speak about the permitting fees. It's not just the cost of processing a particular permit here in the center. Sure. It's the fees, and it's even more expensive, I believe, in the urban area, because the connection to sewer and water and those connection fees are extremely expensive. But we'll come back with a more detailed briefing to the board at some point.
All right, thank you.
Thank you.
Thank you, Art.
Okay, well, thank you.
Next on the agenda is item number 6, department items, the Office of Housing and Homeless Prevention presentation. And we have Tom Webster coming up with Keely. Oh, Keely's not coming up. Okay.
She's not coming up. She's coming up. Okay. Good afternoon.
Can you raise the microphone up for you? Big, tall guy. There you
go. Tom Webster with the Office of Housing and Homeless Prevention. And we're going to talk a little bit, Keely and myself. Keely, we're going to introduce. You stole our thunder a little bit at the Board of County Commissioners. We'll introduce her to you again to the Board of Health, our new Affordable Housing and Homeless Prevention Coordinator. But before I get into a regular presentation, just wanted to follow up on the discussion you were just having. The Thurston Thrives Housing Action Team has been working on something called a housing affordability model that is looking, working with the master builders, that is looking at impact fees and a decision-making tool for jurisdictions to take that would help them make decisions. If we reduce certain fees, how would that impact the affordability of development? So the Incentivized Housing Team, which is a subcommittee of the Housing Action Team, has been looking at some of those issues.
Thank you.
So I'm going to talk a little bit about some of the activities we're working in our office, and then have Keely talk about, throw her into the deep end here 1 week into her new job, and have her provide some information to you as well. But wanted to tell you about our upcoming request for proposal process that we'll be having that allocates the funds that the county has available for homeless and affordable housing issues. In February, we'll be issuing our RFP. We do a consolidated RFP process. We actually issue 3 separate RFPs, but it's under one application process. Those applications will be due late March. The review process occurs in April, with recommendations occurring in May, and then we'll present those recommendations for funded applications to you in June. We have multiple sources of funds that go into those RFP. We have both federal, state, and local funds, so just wanted to talk through briefly those fund sources with you. So our federal funds, the first source we have is Community Development Block Grant funds. We receive approximately $1 million a year. Any numbers I give you are estimates right now. Obviously, with the federal government shutdown, we don't have a final budget yet from the federal government. CDBG funds are rotated between the city of Tumwater, the city of Lacey, and South County. This year, the 2019 funds are used for the South County cities and unincorporated Thurston County. So we'll be having meetings coming up here with the 4 mayors and the county manager, to discuss how to allocate those funds. So that's one RFP. We also receive around $700,000 from the Home Investment Partnership Program. Those funds are used for capital, new construction, acquisition of existing housing, capital dollars. So those are our 2 federal sources of funds. State funds, we receive Consolidated Homeless Grant, CHG funds, which are used for homeless services. We receive approximately $600,000 in CHG funds. And we receive approximately $1.6 million in Housing and Essential Needs, or HEN funds, from the state. Our local fund sources, we receive 2060 funds, which are a document recording fee. Those are also used to supplement the home or capital housing projects, and we anticipate around $250,000 in 2060 funds. And then our largest source for homeless services is 2163, also a document recording fee, and we're anticipating around $1.8 million in 2163 funds. Those are our most flexible source of funds that are used for homeless services. And then finally, we have the Community Investment Partnership funds, which is a combination of the HHSC, the Health and Human Services Council funds. Jurisdictions contribute 1/2% of their sales tax revenue to that fund, and that is combined with funding from United Way. And the total of those funds is around $400,000 per year, and that's allocated to health and human service activities. So all total, we'll be awarding a little over $6 million this summer in funds for homeless and housing service activities. Those contracts are typically 1-year contracts. They will either begin, depending on the fund source, will begin in July, or some fund sources begin September 1, the state fund sources, and then our federal funds generally begin in October. And those projects also have some other environmental review and other requirements that they need to meet before they are actually contracted. So that's an overview of kind of the RFP process. Will be coming to you at the end of January, early February, for formal approval to proceed with that RFP. So at this point, I'll have Keely come up and talk about the point. Oh,
Before you
yeah.
do that, can you ask questions about what you just spoke?
Sure, of course.
Do you have any questions?
So that total figure that you're going to be, through your position, it's going to be about 6 million
That's correct.
for the year.
For the year.
And I'm just curious what it was last year, because apparently the problem has compounded so much more than last year. So does that funding source reflect that increase in need?
So in 2017, we had roughly around 5 million, and we gave 2-year contracts in 2017. So for 2018, the amount of funding we provided was similar. However, the legislature last year approved an increase in the 2163 and 2060 document and recording fees. So we are expecting an increase in those funds this year. Last year, I believe, probably about 1.4 million, and we're expecting an increase of about 400,000, roughly 400 to 500,000, that will have additional available for funding this year. So there has been an increase.
Okay, thank
from
you.
last year.
Significant amount. Ty, do you have any comments or questions?
I don't think so.
You mentioned the United Way contributes to the Health and Human Services, and they currently do for the basic needs and such, but that strategy is changing, or their plan is changing. Will you explain that just a bit? I know you don't speak for them.
Right, so we have one more year of, United Way is committed for one more year of funding into the Community Investment Partnership process. So we will have one more year of contracts through that process. The United Way has indicated that after this year of funding, they're going to kind of pull out of the CIP and use their own process for allocating their funds. They wanted a little more branding over the use of their funds. So the HHSC funds, which are the jurisdiction's contributions, will remain, and then the HHSC will have to make some decisions on how they want to move forward with allocating those funds.
Okay, but United Way continues, but on their own, not in a consortium.
Correct,
Got it,
for one
okay.
more year.
All right. Thank you, Tom. Now
Yep.
go ahead
Thank you.
with Keely.
Okay, Keely.
Oh, hello.
Oh, hello again. Good afternoon. Again, my name is Keely Marino, and I'm the Homeless Prevention and Affordable Housing Coordinator as of 6 days ago. So, Commissioner Menzer, I feel you on the only 6 days into the job. Prior to this, as I mentioned before, I was at Community Youth Services and served as the Director of Sheltering Services through Rosie's Place and Young Adult Shelter. And because of my involvement in that work, I am leveraging the fact that I already attend and have been attending many of these meetings that are now my job to either facilitate or to continue attending. And so I'm able to speak to, say, the Hazardous Weather Task Force, the point in time count, with a little bit, with a leg up. So there are some things I'm learning as I go, but I'm just going to launch into the things that we're working on right now. So I'd like to touch on the June 2018 declaration from the Board of Health on a state of emergency. Yes, public health crisis, excuse me, public health crisis, and where we are and what we have as a department worked on and where we are now. Touch on the Hazardous Weather Task Force, and then where we are with the point in time count. So one of the declarations was for us to offer support to the City of Olympia in their efforts, and we are doing that. We are contracted with the city to perform the point in time count, to coordinate the point in time count through Anna Schlecht and Whitney Bowerman. Also, my relationship with the city in my previous hat, I partnered alongside Colin DeForest, the homeless coordinator with the city, in many meetings, and specifically in the instigation of the initial mitigation site that is happening downtown. I'm continuing to work with him on organizing that or just problem solving with him. I've met with Carrie Retlin, also the home fund manager, and Casey, I can't remember, Schaffler, who is working also with Colin DeForest. So I'm reaching out and engaging with the city actively within my first day or two on the job, and I'm looking forward to how we can leverage that pre-existing relationship between myself and the homeless coordinator there. There's another one of our a section in the declaration is that we wanted to get a Hep A vaccine program going, and that has begun. At this point, I believe about 40 people have received the Hep A vaccine, and I know that there are some efforts made to offer more Hep A sessions, if you will. I know that CYS has reached out to Darlene Hine, who is facilitating the Hep A clinics, and so I know that that's one more clinic that is being planned, and I know that there will be more in the future. All right. Hazardous weather. We wanted to have contracts in place for our cold weather shelter providers, and those have happened, and furthermore, Code Blue funding, and we wanted to have a plan in place for Code Blue efforts, which there has been a draft, and we, at the beginning of December, were able to enact a Code Blue. Code Blue it lasted for 3 days and was fairly successful. We've set aside some funds to make sure that if there are needs in terms of staffing or extra supplies, that those providing Code Blue services will be able to be compensated. The first Code Blue cost about $2,000, and that went primarily to the staffing of the extra staffing provided through Union Gospel Mission, Interfaith Works, at the Salvation Army site. The Salvation Army site on 1505 4th Avenue was donated to us. Speaking with Captain Mark Stearns, we're continuing with that arrangement, and we will continue to find ways to make transportation less of a barrier. Part of the issue that we found with this Code Blue was that transporting folks from various areas in our county to the Code Blue shelter was a bit of a conundrum, and so we've been talking to Intercity Transit on how to train community members or other partnering providers to be able to use their vans to go out and actually pick up folks that want to stay in the shelter during a Code Blue. We're also working on a communications plan, kind of hearkening back to the past in when we used to have not a sheltering season, but we were cold weather, it was temperature dictated. Many businesses in downtown Olympia would put a poster essentially up in their windows indicating whether or not it was a cold weather night, and we're going to attempt to do the same thing for Code Blue. So we have some way of getting that word out to the folks that might need sheltering, that are out in the camps or further out in the community, that they'll know that that is an option. We're also going to be, there was an organization or a group of providers called the Outreach Workers League that was really active about 3 or 4 years ago. We're trying to get that going again to get them out into the Lacey camps and the West Olympia camps and camps that we've been able to identify so that we have a way of getting the word out to them that there's a Code Blue situation. Lots going on with the Hazardous Weather Task Force, and we're convening again after the break this Friday. Hey, you hired me. That was on the declaration, so good job. You did it. And then another action in Section 9 of the declaration was looking at the root causes of homelessness. It is well documented that folks that are overrepresented in the homeless population are people of color, LGBTQ youth, as well as people exiting systems, be it foster care, jail, or treatment facilities. And so one of the efforts that's already begun at the HAT, actually facilitated by myself and Jill Esbeck from Sidewalk, we've convened a racial equity group to be looking at the ways in which we prioritize people getting into shelter and housing, the vulnerability SPDAT, the VI SPDAT, I never remember what that acronym stands for, but the assessment that we use for coordinated entry, looking at that and seeing where there may be discrepancies in how we are accounting for the ways in which identity, be it racial, be it sexual orientation or gender identity, may or not being accounted for in terms of vulnerability. So we're working, we've got Heather Penny from the YWCA. She is helping to facilitate that conversation, just to have an outsider perspective to really keep us on track. So those are some of the actions that have already been taken in response to the declaration made in June 2018. For the point in time count, it's well underway. Anna Schlecht is the coordinator at the City of Olympia. I've been meeting with her and talking to her about my role now, because until a week ago, I was going to be facilitating the event at Community Youth Services for the youth part of the point in time count. So we will be mobilizing teams across the county, and this morning I was going to invite all of y'all to decide whether or not you'd like to participate in that, and everyone already volunteered, so thank you. There's a hope that there's 150 volunteers, and the City of Olympia did issue a challenge for other jurisdictions to get staff to volunteer, and City of Olympia has up to 90 volunteers at this point, and we did put out within our department a call for county staff to join us. So thank you so very much, commissioners and everyone else, county manager, for volunteering with the point in time count. It will go on all day. There will be activities, magnet events at various places down at the Community Care Center. There will be a magnet event. There will be a magnet event at Rosie's Place Community Youth Services. There will be efforts down in Rochester, and then there will be outreach teams. There will also be an event, some form of an event at Union Gospel Mission. At each of the sites, there could be meals will be provided. There may be haircuts. There may be some incentives for folks to participate in the point in time count. This year, we're also using a completely digital system called Counting You. It's an app. And so speaking with Anna Schlecht, the questions that we'll be using are standardized because of them being dictated by HUD, but we've added some of our own questions to them, including where were you living last year, and questions such as that, and some demographic questions. So talking also with Anna, she's working on how a person gives consent via an app, and the app does have a mechanism for that, but she hadn't learned that yet, so she'll be getting back to me on that. So that's where the point in time count is. And then I think I hit the Hazardous Weather Task Force. I think that's all I've got.
Wow. And you just started.
Yeah, no problem. No big deal.
Questions or comments?
Yes, so on your first topic, you identified support for Olympia's efforts, and you pointed out the point in time census and having contact with some various staff. So have you had a sit down with Mr. DeForest, for example, yet?
I have.
Okay, and I'm just, because I would expect that Olympia's asks of us would be a lot broader than help with point in time. So I'm wondering.
Oh, yes.
What was that list? What was the wish list of Olympia in terms of support from Thurston County?
Well, it's with specifically the conversations that I have had have been in how to help them with this, organize the mitigation site in a way that isn't, and it wasn't total chaos, but to help with the organization of that with providers to kind of play a bridge between the city and the county. And then all the other conversations are preliminary. So we'll be meeting with Carrie Rutland, the home fund manager, and Carrie Hennon, actually, and I are going to be meeting to just talk about out-of-the-box kind of permanent supportive housing funding strategies. I'm going to be meeting with Keith Staley and Amy Buckler in the near future. But all of our conversations in my role, in this role, are pretty preliminary.
Sure, understood. Yep. Thank you. My other question was about the point in time count. My understanding is that there's different ways to do it, and we've done it differently over different years. And I was wondering, without launching into, if you could succinctly explain kind of how we're doing it and why we changed from a different way of doing it.
Yes, I think the only thing that has changed is that I'm not clear on whether we're doing a head count. So a head count is different than the point in time count. The head count is not official. That data is not speculative necessarily, but it's not, duplications are not cross-referenced. And that was an effort that we did last year with the point in time count. I am not clear whether we're doing that this go around, that unofficial head count in the camps. That's about the only thing that we're doing different besides the digital app thing. We did paper prior to that. We're still sending folks out, homeless guides out into the camps as we did last year to get into the woods and try to encourage those folks to participate as well. So we're doing that. And I think the app is one of the only differences that I'm aware of. I think there's actually a little bit of a broader reach this year. I don't know if I answered your question. Is there something specific that you're thinking of?
Well, I mean, I didn't think I understood exactly how it was done. Can you just,
okay, sure.
And when I did hear a few days ago how it's done, it kind of surprised me. So I just thought that would be a good thing for folks to understand.
I got it.
How do you go about counting homeless folks in the community?
Well, this is an annual count that comes down from the federal government and the state government to do a one-night point-in-time census of folks that are literally unsheltered. So the point-in-time count is dictated also by the definition of what homeless is according to HUD, which is different than the McKinney-Vento definition. So the forms that we must use when we go out and interact with folks on the streets, most of those questions are questions that HUD wants to know in terms of who is literally homeless, who is unsheltered. So we still count folks that are in the shelters or in some kind of transitional living situation for our purposes, but the federal government wants to know who are the people who are unsheltered. And so when we go in and talk with folks, either at an agency or out into the woods or in a parking lot, we're asking if they would like to participate. They have to give their consent, and then we fill out a form, and usually there's some kind of incentive, some kind of gift certificate or a tarp or something that we can give them in exchange. So it's not, so it's a little bit more fair in terms of compensating them for their time. And so that is the official count that is required of us. And if we ask any questions around demographics that aren't federally mandated, or questions that the community has that they're curious about, such as where did you come from, or where were you living last year, we get to add those in for our purposes, for the county's purposes, to meet our needs. But we do have to ask that certain question set as mandated by the federal government. So, yeah.
And those get asked in the field?
They get asked in the field by volunteers. So volunteers are trained in how to administer the questionnaire.
So the 4 sites that are kind of identified, is those just like sort of the command centers for that particular?
Yes.
Okay.
I mean, some of it is evidence-based. So for a youth count, youth are traditionally undercounted across the board. And so there's been a lot of work done on youth providers to figure out what's the best way to count youth. How do we get an accurate accounting of youth? And so the magnet events are, for youth in particular, are best practices as dictated by some of the federal work groups in DC. So there's there's some that are designed specifically to attract more folks. And then we used to have a second event called the Homeless Connect event in Olympia, where we'd have the point in time count, but then we'd have a Homeless Connect event, which would be all of the resources. That would be clothing and haircuts and maybe a foot clinic and animal services and that sort of thing. Just as kind of a coming together, not necessarily celebration, but kind of a celebration for folks experiencing homelessness. So over the years, it has morphed in terms of what it might look like, but the basic premise is the same. And the requirements are the same for data.
Just one more question.
Sure.
I remember when I was presented with last year's statistics by one of the people that was involved in organizing, they were explaining these numbers, because we changed methodologies, like you can't necessarily compare these numbers directly to previous year's numbers.
Right.
That's kind of what I was getting at when I said a change in methodology from, I think, 2016 to 17.
I think that's because they went out and did that head count in literally counted heads.
And I might have been being presented those numbers, which you're saying are kind of unofficial.
Yes.
Okay.
Yes.
I can chime in and speak to that, Commissioner, and I just want to say, Keely, excellent job describing that process after 6 days on the job. We really value your wisdom and very happy to have you here. Yes, while this annual point-in-time count is conducted throughout the nation and in every state and county in January every year. It's a continuous improvement process for all communities to evaluate how they are assessing the number of people experiencing homelessness at any given point in time. And as a community over the years, our methodology has changed and I would say has greatly improved. We estimate that while we do our best and have many amazing volunteers to count, it's very difficult to get everyone to participate and find everyone, and we believe overall that we're not getting to maybe up to half of the people that may be experiencing homelessness. So every year we try to improve that and employ other strategies to be able to encourage more participation and most importantly to reach people in need of services and help. And that's why we work with our partners to do that as well as do other kinds of outreach. Several years ago, there was a different approach and different contractors that sometimes would go out into encampments, sometimes would not. And so I think every community kind of experiences that, that same issue year to year. But you can clearly see on our trend for Thurston County that homelessness has dramatically increased from one year to the next. It was 40%. The unofficial count that Keely is referring to was City of Olympia provided some of their own funding to do a separate count to try to identify more unsheltered people specifically in the urban areas last year. Because those were not part of the HUD count, we couldn't include them in our official numbers, but it was very helpful for us to be able to quantify the magnitude of the crisis that we're dealing with. This will be our third year contracting with City of Olympia, and so I think having consistent people working on this count and having even broader volunteer participation is really going to help us to improve our ability to identify those experiencing homelessness this year. So really grateful for everybody that is going to participate in the count this year.
Thank you.
Any more? Gary?
Nope, good, thank you.
I have a couple questions.
Sure.
Number one, has CYS replaced your position yet?
Yes.
Okay, good.
Yes, her name is Liz Snyder.
Okay. And you talked about the Hazardous Weather Task Force and Code Blue. There was an attempt to get last year, I think it was Code Silver.
Oh.
Do we have a Code Silver? Is it functioning or no? Either one of you, Shelley?
I'm not aware.
I think you may be referring to the Silver Team.
There
Silver
we go.
Team, like an
Yes,
action
for
team?
seniors.
Okay.
That's part of that's a housing action team subcommittee group. Is the Silver Team?
So that's different then?
That's different.
Okay.
Yeah.
All right. And I don't know if you know Shelley. I wouldn't presume you know Keely. How many Thurston County folks volunteered last year?
I do not know. I do not know the number of Thurston County employees or the total number of volunteers. I believe it was a total a couple hundred people that participated last year to make the account successful, but I don't know how many of them.
At the county level?
I don't know how many were Thurston County employees.
Okay, we've been
we don't have
challenged.
that data.
Okay. All right. Thank you, Keely, very much.
Thank you.
Thank you, Tom. And now we have the Thurston Thrives Update Social Determinants of Health presentation. Liz Davis.
Hello, Commissioners. Thank you for having me here today. Commissioner Hutchings, as you mentioned, I am Liz Davis, and I am the Division Director of Child, Family, and Community Wellness at Thurston County Public Health and Social Services. Each month, you're gracious enough to allow someone to come and give you a briefing on Thurston Thrives, which is our community-wide health and safety initiative. And this month, I'm going to be talking with you about the social determinants of health, which form the very foundation of Thurston Thrives. So, social determinants of health is kind of a jargony term, but it's really just a fancy way of saying that the conditions in which we live, learn, work, and age affect or determine our health outcomes. This is terminology that's used worldwide by every major health organization. The social determinants affect a wide range of health outcomes and also health risks for every single person. They explain in part why some Americans are healthier than others and why Americans are generally not as healthy as they could be. They're shaped by the distribution of money, of power, and also of resources. And they're responsible for health inequities, which are the unfair and also avoidable differences in health status that we see within and also between communities. Health starts in our homes, in our schools, our workplaces, our neighborhoods, and also in our communities. We know that taking care of ourselves by eating well, by staying active, by not smoking, by getting recommended immunizations, going to see the doctor when we're sick, that those all influence health. But our health is also determined by our access to social and economic opportunities, the resources and supports that are available in our homes, in our neighborhoods, and also in our communities. It's determined by the quality of our schooling, the safety of our workplaces, and the cleanliness of our water, our food, and our air, as well as our social interactions and our relationships. Resources that enhance the quality of our lives can have a significant influence on our health outcomes. Examples of those resources include safe and affordable housing, as we just heard, access to education, public safety, availability of healthy foods, local emergency and health services, and environments that are free of life-threatening toxins. We know that poverty limits access to healthy foods and safe neighborhoods, and that more education is a predictor of better health. We also know that differences in health are striking in communities with poor social determinants of health, such as unstable housing, low income, unsafe neighborhoods, or substandard education. On the screen in front of you are the 5 key areas or determinants of health, and each of these reflects a number of key issues that are very important for healthy communities and healthy people. Economic stability includes things like socioeconomic conditions, which can include concentrated poverty and the stressful conditions that accompany it. The availability of resources to meet our daily needs, like safe housing and local food markets, and also access to economic and job opportunities, and these are all affected by the overall economic health and vitality of our community. Education is a focus on learning throughout our entire lifespan, from cradle to career. It includes quality of and also access to educational opportunities from early learning all the way through job training, as well as literacy and access to language skills and resources, which could include things like having materials translated into one's first language. Access to and quality of local emergency and healthcare services is key. Things like, do you have health insurance? Do you have a primary care physician? And do you know how to ask the right questions to advocate for yourself and also to find the necessary resources? So health literacy. Neighborhood and built environment is a category that includes things as vast as exposure to crime and violence, our built environment, which includes buildings, sidewalks, bike lanes, roads, physical barriers such as those for people with disabilities, transportation options, work sites, schools, recreational settings, housing and community design, residential segregation, which might be on the basis of income, on the basis of race or ethnicity, our natural environment, like green space, trees, grass, or weather, which includes climate change. aesthetic elements like good lighting, trees, benches, and exposure to toxic substances and other physical hazards. Our social and community context includes things like our social norms and attitudes, like discrimination, racism, and level of trust in government. The availability of community-based resources to help us, opportunities for recreational and leisure time activities, local culture, social supports and connections between people, social order or disorder, which could be things like the presence of trash or the level of cooperation between people in a community. And even things we often don't think about, like access or lack of access to technology, like cell phones, the internet, or social media. And the ability to participate in local civic processes or governmental processes, and individual and community hope. Healthy People 2020 is something that highlights the importance of addressing the social determinants of health as one of the overarching goals for the next decade. It's a shared initiative between major governmental and nonprofit health organizations worldwide, and its goal is to create social and physical environments that promote good health for all. That means, quite simply, improving the social determinants of health. But how are we actually going to reach that goal? It's important to establish policies that proactively influence social and economic conditions and those that support change in individual behavior. We can improve health for large numbers of people in ways that can be sustained over time if we're able to institute those policies and practices, and improving the conditions in which we live, learn, work, and play, and the quality of our relationships will create a healthier population, society, and also workforce. We've been taking a lot of steps locally over the last several years toward achieving that goal. Thurston Thrives, which at least a couple of you have heard about repeatedly so far, and Commissioner Menser, I know that you've heard the term and you'll be continuing to hear it from us and be getting updates on a monthly basis. It's a public-private partnership that is designed to engage everyone in the community around improving community health and safety. It takes a systems approach to identifying priority health outcomes and implementing cross-sector strategies to achieve those targets. Thurston Thrives began a little over 5 years ago. Oh gosh, almost 6 years ago now. It was founded by the Board of Health at that time. And partners from all over the community, more than 300 individuals, organizations, and agencies convened around several different action areas. And the goal was to improve overall community health, and it's based on the social determinants. The goal is to focus on large-scale outcomes rather than just outputs and program goals. All of the teams that you see on the screen work together to create detailed strategy maps that got everyone on the same page, which is really no small feat. In December 2014, it transitioned from a county-led initiative to a community-led public-private partnership. And through Thurston Thrives, literally hundreds of community members have come together in these 8 areas: clinical and emergency care, community design, education and resilience, which includes issues affecting children and youth, as well as our economy, our environment, including climate and clean energy, food, housing, and also public safety and justice. Regionally, the Cascade Pacific Action Alliance is a regional partnership between Thurston County and 6 other counties. Our Thurston Thrives priorities feed into our county's community health improvement plan, which then rolls up into our regional health improvement plan, which is created in partnership with these other counties. Our goals of our regional health improvement plan are to improve health equity and health outcomes for all the residents in our communities, with a focus on addressing the social determinants to keep our residents as healthy as possible for as long as possible, and to focus on prevention and intervention, as well as reducing per capita healthcare costs while improving the quality of care for residents. By focusing on the social determinants since the beginning of Thurston Thrives, we started out as the 14th healthiest county in the state out of 39, which is not that great. And in those 5 years, we have had a 57% improvement in our health ranking, and now we're the 6th healthiest county, and our goal is to continue on that trajectory until we are the healthiest county in the state. So that's all from me. What questions can I answer?
Aye. Gary?
Nope, good job.
If we're 6th, who's number 5? Who do we need to beat?
Who's number 5? Ooh, yeah, that's a good question.
I want to know who 4 and 5
Yeah,
are.
we got to keep our eye on the prize. I should write each one of those on my fingers and just check them off.
But other than that, no. Thank you very much, Liz.
Okay.
Thank you.
Thank you.
And now we're moving on to the Board of Health members, where board members can talk about social service involvements or public health issues. If you have any. Do you have any?
Oh, I guess water quality, biosolids on the Nisqually River. That's a new proposal being made that the ecology is looking at issuing a permit to allow that, and I don't think they've quite got it figured out yet. So yet to be determined if they're successful or not on that endeavor.
All right.
That'll be it.
Commissioner, anything?
Nope.
Nor do I. So we'll move right on to the the health officer's report. Dr. Rachel Wood.
Good afternoon. It's a pleasure to be here. I'm going to focus my report on 2 separate areas. The first is vaccine preventable diseases, and I'm going to talk briefly about measles and influenza. And the second one is an incident that occurred in the community in the first week of the new year, and how partnerships have been exquisite in helping to address that incident. So first of all, just for the community to be aware of the fact that vaccine preventable diseases are still unfortunately very active throughout the globe and also in this country. Currently, New York State is experiencing, has experienced 167 cases of measles since September, and it's the worst outbreak since the 1990s, and 80% of the individuals in one specific area had not been vaccinated against measles at all. And measles is preventable by getting vaccinated with the measles, mumps, and rubella vaccination. In fact, it's a very effective vaccine, and after one shot, 92 out of 100 people are protected against acquiring measles. How that relates here is that in the state of Washington, just over the weekend, this past weekend, we had a case of measles diagnosed in Clark County, and across the border in the state of Oregon, another case of measles in the Portland area. And people are very mobile up and down the I-5 corridor. So my suggestion and recommendation is, if you are not up to date on your measles vaccinations, please consider getting vaccinated. If you can either go to your healthcare provider or you can go to a local pharmacy, I would call first to see if they have that specific vaccine. If not, you can also go to vaccine.gov and put in your zip code, and they will let you know the nearest location where you can get the vaccination. Moving on to another vaccine preventable disease, influenza. Influenza is, we monitor influenza very carefully, usually on a seasonal basis from the 40th week of the year up until the summer comes. And the reason we do that is we really want to be alert to anything that suggests a change in the components of the influenza virus such that human beings would not be protected. All of us alive currently have been exposed to influenza, and that in itself provides some protection. The vaccine is available and recommended for all people ages 6 months of age and older, and we have different types of different forms of the vaccination. You can get it either as a nasal spray or as an injection, and I'm happy to answer questions about that in more detail. There are also 4 medications available if you happen to get influenza. And that's exciting because there's a new one available this year that the way it works in the body is different from the previous 3. We've had Tamiflu and Relenza and another one that is an IV medication, but now we have Xofluza, that's the brand name, and it's made slightly differently, so it has a different area of effect in the body, and it's supposed to be effective against influenza A and influenza B, which is a good thing. Along the lines of cooperating with partners, I would like to say that my predecessor successfully got together an informal group of infection prevention individuals in a 3-county area, including Mason, Lewis, and Thurston. And together with my investigation and control of disease staff, since I became the health officer in Thurston County, we've continued that informal gathering. The idea being seeing what the numbers are for influenza statistics at hospitals in these 3 counties, getting an idea of numbers of what we call influenza-like illness. ILI is, we like to abbreviate everything, but the discharge diagnosis from hospital emergency departments, how many of those diagnoses are influenza-like illness, of influenza tests that are ordered, what are the % that are positive, and as that starts to ramp up above more than 10% positivity rate for just the tests themselves, we start to look around. We're also looking to see how many people are getting admitted to the hospital with a diagnosis of influenza, and if there are any deaths related to influenza. And so far in the state of Washington, since week 40 of the year, we've had 9 influenza deaths, and just recently in Thurston County, unfortunately, we had 1 individual die of influenza, a person over the age of 80 with other related illnesses. So again, this is just a recommendation for people to strongly consider getting a vaccination against influenza. And the part of the vaccination against influenza is that it protects against complications of the influenza illness. It may not be as effective as measles vaccine in preventing acquiring the illness, but there are complications that you don't want, including hospitalization, pneumonia, and death. And so the vaccine does prevent the complications associated with acquiring the influenza disease. Getting back to the informal group of infection prevention individuals, and there are several members of that group, we look at those statistics and together make a determination that we would like separate institutions to institute masking for healthcare workers in those institutions that either cannot, because not everybody can get the influenza vaccine, or choose not to get the influenza vaccine. Masking is just one of a bag of activities that we like to recommend for people to avoid respiratory illnesses. Those include washing our hands, covering our cough, and staying home if you're sick, rather than spreading your respiratory communicable disease with the people around you. Masking will prevent the spread of visible respiratory droplets. So if you sneeze and you have a mask, you're not going to infect the person next to you. And also, if you have a mask on and somebody else sneezes, then you're not going to get their respiratory droplets coming your way. I'm going to move on to this other topic, but first let me pause and see if there's any questions from you.
Go ahead.
Just one, that new flu treatment, is that available at a drugstore, or?
You asked the question that I asked. I contacted the Washington State Pharmacy Association this morning, and I have yet to hear back from them how available it is, because the brand name is XOFLUZA.
Say that again.
XOFLUZA, an exciting name, Xofluza. And Commissioner Edwards, I didn't hear back from the Pharmacy Association yet. No, no, just about its availability.
Well, maybe you can let the county manager know or something when you find out.
Yeah, certainly.
Commissioner Menser, you have any questions?
No.
Have you heard any incidents of chickenpox?
Nothing that I am aware of. Jeannie? No.
No? Okay.
No, but that's a good question. You know, some of these viruses are just pesky in terms of how adapted they are to spreading.
I had a granddaughter up north in Seattle, and it looked like in the pictures chickenpox, but the doctor said that's a virus. Okay, but they never identified it.
Exactly.
But it looked like chickenpox.
Well, chickenpox, it looks like rose base with a sort of pearly water vesicle on the surface.
Yeah, I'll show you a picture here. Thank you, doctor.
Oh, okay. Yeah, well, it's a red spot with a white blister. So moving on to another topic. So last Wednesday, on the 2nd of January, an individual who was in the emergency room lobby of St. Peter's Hospital opened a vial of an unknown substance. Out of caution, multiple partners responded. I could name lots of them, and I will name some, but I want the listening public to be aware, and excuse me if I don't mention every single individual and organization. So the people who responded were several teams within the Providence healthcare system and the Providence St. Peter's Hospital, Olympia Fire, Lacey Police, Thurston County Public Health and Social Services, Thurston County Department of Emergency Management, law enforcement, including Washington State Patrol, FBI, and also the Camp Murray Hazmat team, and the Washington State Department of Health in several different capacities, including communicable disease epidemiology and the laboratory. The substance was transported by our law enforcement partners to the Washington State lab, and the results came back, preliminary test results, as the substance was containing ricin. Working together with experts at the Washington State Department of Health, I was able to determine that there was not and is not an ongoing public health risk from the results of the incident. For you to know, ricin is most dangerous if it is inhaled, ingested, or injected into the body. It's not contagious person to person, so that was extremely helpful. I'm just going to consult my notes, since if I can find them. Okay. Providence St. Peter's Hospital and Thurston County Public Health and Social Services worked together to identify individuals who may have been exposed to the substance. Exposure was defined as skin contact with the substance without personal protective equipment. We wanted to ensure that anyone who may have had skin contact with the substance got appropriate follow-up care. Ricin is a substance that's found in castor beans, and if you are trying to, if you eat castor beans, ingestion may lead to the release of ricin, or you can like commercially try to extract ricin from the castor beans, but you would have to have like more, like a pound or more of the castor beans. It is not something that is intentionally that people are exposed to. It would have to be a purposeful action for people to be exposed to it. And the support, the onset of symptoms from exposure to ricin depend on the route of exposure, if it's inhaled, if it's ingested or injected into people. But the way ricin works is it affects the ability of cells to maintain themselves, and so there's cell death and therefore tissue death and then organ death, and then the human being dies. So we did not have an exposure. We did not have the general large exposure for the general public. I wanted to make a point of how well partners all work together, and I hope that I did not leave somebody out who was involved in this. And I really appreciate all of the work that the partnership did to keep the public safe.
Anything?
No, good, thank you.
Good, thank you very much, Doctor.
Not good. Thank you.
So moving on to the director's report.
Thank you, commissioners. In the interest of time, I'll keep this brief. I wanted Dr. Wood to have a chance to share a little bit more about all of the wonderful things that the whole team has been doing, and including express my thanks to those who responded and supported that incident, both within our department and county, and to all of our external partners. Just want to highlight a few of our program activities that have happened over the last month. In terms of substance use prevention, you'll continue to see in both Mason and Thurston County bus ads that say vaping, not as harmless as you think. This is a message that is part of a regional effort that we continue to put out to reduce youth initiation of tobacco and vaping use. And also we distributed drug-free signage for public school campuses throughout the county as part of our youth marijuana prevention efforts. Art Starry covered the legislative priorities. An additional priority in your packet that you may have seen is Tobacco 21. That is an effort to raise the legal sales age for tobacco and vaping products from age 18 to 21 to reduce youth access and initiation of tobacco and vaping products. What we know is 95% of adult smokers report that they started before they were age 18. So this is an effort that's coming in a bill that has been introduced to the legislature for the third time this year to raise that legal sales age. So that's something that we'll be watching and talking to you more about. Also, in terms of substance use prevention, I just want to point out that the treatment sales tax, which is focused on providing funding to mental health and substance use treatment, is part of our department and is currently recruiting new members to be representatives on the Treatment Sales Tax Advisory Board, of which the Board of County Commissioners appoints, and we have applications available on our website for anyone that has a great passion for that work. Our Nurse Family Partnership Program has had a very busy year, serving 375 families and delivering 4,022 home visits during 2018. Yet they continue to have a very large number of referrals and wait lists for both Thurston and Mason County, and they also serve Lewis County. Another legislative priority on our radar is increase to home visiting dollars. And as you recall, last year, Fight Crime Invest in Kids made an award to Thurston County Commissioners and our Thurston County Nurse Family Partnership Maternal Child Health Program for their efforts to increase education about that program, specifically to policymakers and legislative members to advance this effort. And we're happy to see that that's carrying forward in this new session with a proposal for a universal home visiting program, which could serve 17,000 new families. So we're looking forward to more on that. Another program we have is our Special Recreation Program, and that's for adults with disabilities and their chance to increase their social connections and participate in programs. And our winter brochure this year includes a trip to the Olympia Symphony, the Pierce College Planetarium, and the Tacoma Art Museum. We have a generous donation from the Park Foundation, which I just can't give enough thanks and credit to, for subsidizing our county program so that it can be accessible and inclusive to everyone who wants to participate. And for those that may have a family member or would like themselves to participate in the program, they can visit our website, and we still have openings in our upcoming recreation programs. Our syringe services program has collected 1,377,901 syringes for disposal, and that was as of last month in December. 12% of those syringes are for disposal only, meaning that we are taking more in for disposal than we are distributing, which is a good thing. We also, our program staff, dispense 1,381 doses of naloxone, which is a life-saving drug that can reduce overdoses, and we're very happy that we're able to supply that and distribute that to those in need. The next meeting of our opioid task force was normally scheduled to occur the first Monday of the month, but we moved that to next Monday, so that would be January 14th, in order to have presenters from Snohomish County that will share their experience and wisdom in using an emergency management model to respond to the opioid crisis. We continue to advance our efforts declared in the opioid crisis resolution that the Board of Health declared back in June, and are continuing to work with a broad group of stakeholders in developing an opioid response plan for Thurston County. We'll be reporting more to you on that coming up. Vital Records was mentioned also as one of our foundational public health services, and in the last month we issued 279 birth certificates and 863 death certificates, and that modernization proposal to the legislature is to improve security for those we serve and raise the fee to fully cover the cost of vital records. So we're really happy to be able to provide that service at 412 Lily Road for anyone that needs those records. Do you have any questions?
Questions? Questions?
Nope, pretty good.
1 million syringes, is that for 2018?
Yes, sir.
Okay, wow. That's
1,300,000.
Yes, that's correct.
Taken in.
Yes.
How many distributed? The same number?
No.
No,
Less.
less than that.
Less than that, okay.
Yes.
Good.
The opioid crisis meeting, is that an open meeting?
Yes, it is an open meeting, and yes, we.
Who's on that team?
There's multiple representatives on the team. It is co-chaired by Prosecutor John Thunheim and myself, and includes representatives from law enforcement, from healthcare, from public health, nonprofits. There's many different stakeholders. It's a really broad group. We have had attendance of up to about 50 people each month that have committed to dedicate their time to work on this task force and help us develop the response plan.
So
You're welcome to attend.
Okay.
We would love it.
There's not a commissioner assigned, but we can attend.
There's not an assignment, but it is a working task force. So those that are participating are not only bringing their perspective to the issue, but also joining together to help work on that plan. There are various elected officials and other government representatives that do participate as well.
Again, that's the 14th at
Yes.
412 North Lilly, PHSS department, so
Yes.
the public health department.
Yes.
At what time?
That's correct.
3 p.m.
3 o'clock.
3 to 5. Thank you.
Thank you very much.
Anything else? That's it?
That's
Any
it.
other questions? Ty?
Nope.
Gary? Romero? Nope, that's it. All right, motion to adjourn?
Move to
Oh,
adjourn.
sorry.
Move to adjourn.
Second?
All in favor, say aye.
Aye.
Aye. We're adjourned. Thank you.